tell you the reason. I also lost someone very close to us due to being quiet and the stigma attached to it. And she's supposed to be very educated and well known, and you wonder, why would you have left it so long?
The advocacy visit coincides with the 2025 World Earth Day celebration, and the First Lady was quick to note the significance of fighting cancer among women and the theme of the day.
There's no better cause than this. If it is a cause to save life, I will gladly do that over and over again. And like your theme today, which is healthy beginnings, we're starting healthy and is hopeful future. I believe that Mr. President wouldn't have picked more slogan for his administration than the renewed hope agenda. Our hopes as Nigerians have to be renewed. There's hope in this country.
There is a need for sustainability or cervical cancer screening program using HPV DNA test, which is recommended by WHO.
Within 9 months since the launch of the HPV vaccine in Nigeria, about 12.3 million women have been vaccinated across the country, with another 6 million targeted before the end of this year. In the State House, Adeniyi Taiwo, NTA News.
Nigeria's First Lady is calling on stakeholders and other Nigerians to work towards creating a world where mothers can safely give birth and children live healthy to reach their full potential. She said this in her message marking this year's World Health Day with the theme Healthy Beginnings, Hopeful Futures. The First Lady, who notes with concern that so many women and newborns lose their lives daily to preventable complications during pregnancy, childbirth and postnatal period, insists that no mother should have to risk her life to bring a child into the world, and no newborn should be denied a fair chance at survival. While congratulating all health workers for their great sacrifice to make the world a healthy place, the First Lady renews her call on stakeholders to invest in maternal and newborn health, not only as a moral responsibility, but also as a fundamental cornerstone of sustainable development. A year-long campaign focused on maternal and newborn health is the target for the nation in 2025 to end preventable deaths and prioritize women's long-term well-being. Elizabeth Omori, who was part of a health walk in commemoration of the 2025 World Health Day, reports that WHO urges nations to accelerate action to save more lives through integrated health services.
As 2030 crawls in gradually, reducing maternal mortality ratio is expected to be less than 70 per 100,000 live births.
Some women, headache, all these kinds, small challenges of body pain, stomach pain, all these kind of things.
Critical actors in the health sector are optimistic that through universal access to sexual and reproductive health services, commitment to equitable, accessible and quality health care will reduce the prevalence of maternal mortality to the barest. Achieving this target informed this walk to raise global attention to extend life expectancy.
Health is an outcome to everything we do. And I'd like to commend the Nigerian government for taking the stage to really initiate action to accelerate reduction of maternal and neonatal mortality.
Now, local governments are expected to play active parts in this area of improving primary health care to ensure that more of our people continue to have healthy beginnings for a hopeful future.
Poverty and inadequate community health workers, they say, pose risks to healthcare delivery. They recommend political commitment to public health. In Abuja, Elizabeth Omori, NTA News.
All right, to continue the conversation on issues of priority as the world marks World Health Day, we have in the studio Dr. Walter Kazadi Mulumbu, the WHO country representative to Nigeria. Glad to have you join us on NTA International News. All right, now, how is the World Health Organization working with the Nigerian government to strengthen the country's health system, particularly in the areas of primary health care and health workforce development?
Thank you for having me. And first of all, let me take this opportunity to wish all of us happy World Health Day, the day where we remember when WHO was created by member states. And ever since, WHO has been working with the government to strengthen the health system. And particularly in Nigeria, as you know, since last year or so, we've been engaged with the government in co-creation of the SWAP and the Nigerian Health Sector Renewal Investment Initiative, and this plan to save lives, reduce pain, streamline health industrialization, and ensuring health security for all. WHO work alongside Nigerian government to set up standard and norm and ensure monitoring of the implementation. We also work the government to frame the primary health care approach. Primary health care, as I used to say, is not primary sick care. It's a comprehensive approach which encompasses multi-sector policy and action and community engagement and empowerment, which we did through the celebration all the way today, and the essential public health function and integrated service delivery. We also support the government to monitor health trend of diseases, and also responding to disease outbreak when they occur, particularly in the communities where they happen. And we work with the government to raise awareness and advocate for more resources. And I would like to take this opportunity to really congratulate the Nigerian government for the stride to increase investment in health, particularly at this particular time where the whole world is facing reorganization of global health.
So we want you to speak more on the strategies that the WHO is implementing in Nigeria to prevent and control infectious diseases that are tailored to our local context here.
As I said, WHO work to support the government in response to the request. WHO, particularly for infectious diseases, we work with the Nigerian Center for Disease Control and the Minister of Health to monitor disease trend and to put in place surveillance and response measures that are required based on condition and incident that are affecting Nigeria. And one of such incidents is the recent meningitis outbreak, which is spreading around a number of states. We've been able to bring into the country over 1 million doses of pentavalent meningitis vaccine and to vaccinate in the states that are affected to stop this outbreak. So we have other examples, such as what we did with diphtheria outbreak when we brought diphtheria antitoxin and diphtheria vaccine in the country to vaccinate population that are affected, and many more. So we work around identifying the diseases, improving surveillance, and building capacity, training rapid response teams to respond to outbreak where they hit.
All right, now looking at this year's theme of the day, what initiatives is the organization imploring to support Nigeria in improving maternal and child health?
As we said today, the theme is healthy beginnings, hopeful future. Healthy beginning means making sure that pregnant mothers attend the antenatal clinic care at least 4 times during the pregnancy. Healthy beginning is also making sure the pregnant mother has good nutrition and also benefits from preventive measures to ensure that the newborn is born healthy. And when the newborn is born healthy, we need to ensure that the condition for his healthy growth are met, whether through vaccination, nutrition intervention, or when they get to adolescent age, adolescent-friendly intervention are implemented, and so on and so forth. So we emphasize the need for the government and other stakeholders to really recommit to ensure healthy beginning and hopeful future. And today, it was also, we were privileged to be received by the First Lady of the Federal Republic of Nigeria, she was receiving the National Task Force on Cervical Cancer Elimination. And we were pleased to note a commitment, a pledge for new resources to accelerated effort to fight cervical cancer in Nigeria. So we will stay on course and continue to support the Nigerian government based on needs of the communities and as expressed by the government of Nigeria, particularly the Minister of Health and Social Affairs.
We thank you so much, Dr. Mulumbo, for sharing those insights.
Thank you for having me.
You're watching News at 7 from our studios in Abuja. It's time now to take a break to bring you some messages. Do stay tuned. Thank you for saying, as part of measures to effectively eliminate malaria in Nigeria, the National Malaria Elimination Program has signed a memorandum of understanding with the Nigerian Medical Laboratory Science Council of Nigeria. Uche Gochukwu reports that this partnership is to strengthen efforts to end a disease that claims thousands of lives and hampers economic growth. We apologize sincerely for the loss of audio in that report. We shall bring it to you subsequently. Now, the National Health Insurance Authority, NHIA, has directed all its stakeholders to step up their duties towards reducing delays in accessing services and ensuring that enrollees receive quality healthcare services. In a statement by Emmanuel Onopono, Acting Director, Media and PR of the agency, says the directive has become imperative in view of notable delays in authorization of treatments and issuance of codes, which continues to negatively impact beneficiaries' experiences. He said these steps are consistent with the effective implementation of the NHIA Act 2022. The following changes regarding authorization of care were approved at a stakeholders meeting in February. These include authorization of care and issuance of authorization codes by HMOs, which shall no longer exceed 1 hour from the time of request by providers of healthcare facilities. In a bid to strengthen broadcast collaborations and form strategic alliances, Minister of Information and National Orientation Mohammed Idris has led a delegation of heads of government agencies to the 2025 National Association of Broadcasters Conference and Workshop in Las Vegas, USA, with the theme, The Technology, the Trend, the Future. The workshop will cover a range of topics, including artificial intelligence, cloud visualization, the creative economy, and sports production and streaming. The minister is joined by key directors general and CEOs of Nigerian broadcasting agencies, including Salihu Abdulhamid Dembus, Director General CEO of the Nigerian Television Authority, NTA, Ali Muhammad Ali, Managing Director, CEO, News Agency of Nigeria, NAN, Charles Ebuebu, Director General CEO of the National Broadcasting Commission, NBC, Dr. Lekon Fadolapo, Director General Advertising Regulatory Council of Nigeria, ACAN, and Jibrin Babandachi, Director General CEO, Voice of Nigeria, VON. The National Association of Broadcasters Conference attracts thousands of industry leaders from around the world and offers a unique opportunity for the Nigerian delegation to explore new partnerships, engage in content sharing initiatives, and gain valuable insights into emerging trends and technological innovations. The Hong Kong stock market saw a 13.2% drop on Monday, its largest one-day decline since 1997 crisis, as a massive sell-off was triggered by U.S. tariffs and China's retaliatory levies. Reports say most people expected this during the holiday, that the U.S. stock market would plummet. Wang, a businessman from Beijing, predicted a better outcome for Beijing's trade market expressing his hope in a good tariff cycle among China, Japan, and ASEAN countries. However, French citizen Leonte viewed Trump's tariffs as measures to scare the other parties, calling on the international community to shift the U.S. incumbent's stance.
He will implement, and he already implemented, in order maybe to scare a little bit the other parties. And I really hope that the international community will try to convince him that it's not the right thing to do. I don't know, to negotiate with Trump in order to not to do the same thing for the US market, because otherwise it will not be a very good thing. I think this should stop, and we should negotiate in order to regain the trust of both parties, European Union and the United States.
Now, African Union mediators are in South Sudan's capital, Juba, for talks aimed at pulling the country from the brink of a new civil war after first Vice President Riek Machar was placed under house arrest last week. Martin Elia Lumuru, South Sudan's Minister of Cabinet Affairs, told African Union mediators of the transitional government's commitments to peace. Clashes erupted in January between South Sudan's People's Defense Forces, led by President Salva Kiir, and Machar's opposition party's armed wing. Reports say President Salva Kiir government has accused Machar, who led rebel forces during a 2013 to 2018 war that killed hundreds of thousands, of trying to stir up a new rebellion. For the first time since the crisis in the Democratic Republic of Congo drew global attention, the Congolese government and the M23 rebels have agreed to hold direct talks, believed to be a prelude to the needed peace. Kolo Mohammed reports that there has been massive mixed feeling amongst citizens.
As the Congolese government and the M23 rebels prepare to engage in direct talks in Doha this week, a mix of hope and mistrust hangs over the city of Goma. The doubts are believed to have emanated from the many times before now talks were held towards peace, and no agreements have been reached, even though ceasefire partially agreed upon in the past never stopped the violence. Citizens currently pray God touches the hearts of key figures in the process, hoping that fiercer fights will not come up after the talk. Some residents, however, believe this upcoming talks will finally put an end to the violence that had plagued the region for years. These optimistic residents believe the warring parties will find a solution to incense the violence that had killed thousands and displaced millions, further calling on the Congolese government and the people occupying Goma to come to final agreement for peace. Believe this round of talks is hinged on a factor believed to be exhaustive both ways. The warlords are tired and fast running out of resources, and the government cannot stand ceaseless loss of lives of citizens, believing this talk may mark a turning point in efforts to resolve the conflict. Since the beginning of the crisis, there had been a huge mistrust between the two sides. This time, there seems to be a willingness to engage in direct talks, excluding proxies. Kolo Mohammed, NTA News.
And that does it on the news. We thank you for being a part of it. I'm Lami Ali. Shegun Ajayi has been the sign language interpreter. Do have a good evening.